Good morning. Today is the day that I'm having my laser eye surgery. It's 7:10 and my appointment is 8:30. I'm the first appointment of the day, which I'm really glad about because obviously COVID and stuff like that, it just makes me feel better knowing that I'm going to be the first patient in there. Obviously I know it's all like clean and whatever. But yeah, I didn't sleep very well at all, but I think that's to be expected. I went to bed at 12 and I've been up since 4:30. And then obviously I had like mental dreams. All forms of danger were in my dream. Fire, running away from something, like everything. It's weird because it's such a common procedure to have done and they do it like thousands of times, but there's still just something really quite scary about. I mean, some people are scared of mascara going in your eye, so yeah, I am feeling nervous, but at the same time I think because I've paid for it and it's all done, I almost feel like it's out of my control now, which is a good way for me to handle things. I'm not going to vlog there, I'm not going to take the camera there because I don't know what their policy is for filming, and because I haven't asked in advance I feel like it's not the right thing to do, but I'll let you know how I feel afterwards. And my appointment is tomorrow, my checkup appointment is tomorrow at 9 AM, so I think by tomorrow I'll be able to give like a bit of a more in-depth lowdown of what it was like, if perhaps I'm not feeling up to it later. So yeah, I will keep you posted.
So we're about an hour and a half post-op. How are you feeling, Sasha?
Not fun.
How was the procedure?
The procedure was fine. Basically, I've been fine ever since you picked me up. The journey home was horrendous.
Yeah.
Because your eyes are closed and someone else is driving for you, and then the stinging's just starting. Like, by the time we got in the car, that's when the stinging was starting. It's a lot. I feel like no one told you that this pain was... Like, it does. The procedure doesn't hurt, everything about that's fine, but no one tells you that this stings, like, a lot. I'm meant to be sleeping, but I can't because I'm in too much pain, so I'm just taking paracetamol.
What are those things you've got on your face?
My shields to sleep so you don't touch your eye. Which I'm sure, as you can see, my nurse has placed brilliantly. Why is it on my fucking lip? Look how far down this masking tape is!
To make it sure it stays in place.
Oh God.
So at the moment, do you think you'd be happy to do it again?
No.
Very good. So you're gonna go to sleep now.
I'm gonna try.
Franco's looking at you as if he doesn't know what
Where
the hell's
is it?
going on.
Where's his head? Oh.
I'm going to talk about this like further in the sit down video, but the pain that I was in once I got into the car was just like, it was awful. I still can't fully look at the screen because it's very bright, but only in the last 20 minutes have my eyes stopped like profusely stinging. And I was just saying to David, I think the worst thing about it is that nobody warned me, and I get that that could be difficult because it's different for for everyone, but I was expecting zero pain. I was expecting like to feel nothing. And when you go for your pre-op, they put some drops in your eyes and they say these are going to sting. It just feels like someone's, like you've cut onions, and you might get the stinging for a couple of hours after. And that was fine. And today when she explained everything, she was like, you know, when you get the sting in, it's just like cutting onions. So in my head I was just ready to compare this to that, and it wasn't. It was just horrendous. Like, when we were driving home I couldn't even open one eye, and I was like, is that normal? Like, why can't I open my eye? Why can't I open my eye? But anyway, it's what's the time now? It's 1:45. I haven't managed to sleep because I just was in too much pain. But yeah, I am feeling better now. I feel like now everything I'm feeling is what I was told I would feel. Today is Sunday, the next day, and I'm on my way for my checkup. So yesterday, once the drama had finished and the pain had gone, I was absolutely fine, wasn't I? Just did the drops every 2 hours, and I kept my sunglasses on pretty much all day, even in the house, because my eyes did feel sensitive to light. Even now they feel more comfortable with the glasses on, but I have woken up today and it feels like mental how much I can see. And I was saying to David, it's almost weird that I can't remember what I used to not be able to see, because I can see so much now. But anyway, I'm going for my the checkup appointment, and I think he just checks that everything's okay, and then that's it. It's quite a strict 2 weeks of things that you can and can't do, mostly can't, but that's it. Overall, I would probably endure that pain again if it meant I had to go through getting this level of sight again. I just wish someone had told me. Hi, my name is Sasha. If you're new here, today I'm going to be talking about my experience with laser eye surgery. This is a video that I've wanted to film for ages, but I wanted to wait until my final checkup appointment was completed so that I was officially discharged from the clinic that I got mine done. I did a Q&A on my Instagram, and I have literally got hundreds of questions, so I'm going to try and get through as many as I can to make sure that I cover everything, pretty much. Question number 1, how much was it? I think it varies wherever it is that you go. I paid £3,950 for my laser eye surgery. It sounds like it's such an obscene amount of money, but it was, and absolutely is, the best money that I've ever spent, and has been a life-changing situation for me. What was your prescription? So my prescription, by the time I went to have my laser eye surgery, do you know what? I'm actually confused, because I've gone on my Vision Direct thing to check, and it says that I was minus 3.25, but I'm pretty sure that I was minus 3.75 at one point. So I'm pretty sure that I was minus 3.75 in both eyes. I know that they were the same in each eye. And yeah, so that was my prescription. Okay, so obviously the main question was, did it hurt? Now, I have a really torn opinion on this, because when I was doing my research and I was asking everybody I knew, you know, the main question you do want to know when someone is going to laser your eye open is, does it hurt? And I asked everybody that I know who had had it done, and every single person said, no, just a little bit uncomfortable, you can't feel anything. Again, I think it is different for each individual person, but nobody told me about this one particular pain that happened during mine, and you'll see it on the part of the vlog. But when the aesthetic drops, no, what's it called? Anesthetic. What's it called? Local anesthetic, yeah. When the anesthetic drops wore off after the treatment, that pain was unbearable. The most discomfort I felt on the lead up to the surgery was on one of the appointments. The optician popped some drops in my eyes, and she said, this may sting like onions. And that is exactly what it felt like. It felt a little bit like when you cut onions and your eyes get really stingy, and it wears off after sort of 10 minutes, and that's exactly what happened. Right up until the operation, I hadn't felt any pain whatsoever. On the day of the operation, before we went into the surgery, the lady kind of spoke us through the situation, the procedure, and she says, you may get some stinging. And when she was talking us through the eye drops, which I'll talk about in a minute, she said that one of the things you can get is that it feels like your eyes sting. So after speaking to everybody I knew who had had it, and them saying that it didn't hurt at all, and the lady going through absolutely every detail that she could have possibly gone through, and only saying that it's going to sting like onions, that was my only expectation of it hurting. During the procedure, not one single thing hurt. The clamp didn't hurt, the laser didn't, you can't feel anything. There is no pain involved, there was no pain involved for me in that entire procedure. Each eye takes 30 seconds and it's completely over in 30 seconds per eye. By the time I had sat down after my procedure you wait for about 10 minutes in the waiting room, then you go to the surgeon, he just checks your eyes through the lens. And by the time that had all finished and I'd got into the car for Dave to drive me home, this pain started coming, and it wasn't like onions. It was like someone had got a raw red chili and was rubbing it on my eyeball. And the pain was so bad, but what made the pain worse was that I wasn't expecting it. So I was then panicking because my eyes were really watery and I couldn't really open them because it felt so sore. And they do say after the procedure, you'll probably want to keep your eyes shut for a certain amount of time because it feels comfortable. So David's driving me home, my eyes are shut, but at the same time, the burning is absolutely unbearable. I would like to say that I have quite a high pain threshold, but I'm pretty sure what made it worse was that I wasn't expecting that pain. So I was then panicking, and that was what made everything 10 times worse. By the time we got home, I took paracetamol straight away and the pain eased off after an hour or so, and then I managed to sleep for quite a while. At the same time, I also understand that every single person reacts to these procedures differently. Perhaps nobody else felt that sort of pain, or perhaps no one else had experienced anything more than the stinging onion, so therefore there was no need to say anything. When somebody asks, does it hurt, it's not a simple yes or no answer, because nothing about the procedure hurt, but when I'd got into the car and the anaesthetic drops had worn off, it was pretty painful. What does it actually feel like? Can you feel a needle scraping or anything? That is disgusting. I felt nothing. I honestly felt nothing. The only thing was that when the laser is going on, they say that you can feel a pressure on your eye, and I didn't even feel that. I felt nothing. My surgeon was fantastic. I felt like he spoke every second that there was something going on. So my only focus was listening to what he was saying. And by the time he finished speaking, the surgery was over in one eye, and then he started again, and then it was over in the other eye. So it was really kind of easy for me to focus on what he was saying rather than focus on, am I going to feel pain? Am I going to smell burning? All of those things, because I didn't feel any of that. Next question is, how is the recovery process? This is one thing that really stresses me out about laser eye surgery, and when I was doing this Q&A, somebody spoke to me in my DMs about it, and she said that there used to be an advert that promoted it's so quick and easy, you can have laser eye surgery in your lunch break, which in my opinion is absolute bollocks. There is no way I could have had that done in a lunch break and gone back to work. On the day of the surgery, I was in the clinic for about 4 to 5 hours, I think it was in total, because you have all of the pre-chat and they take you through everything, and then you have the procedure, and then you have to wait a little bit after. So they ask you to allow for that amount of time. I came home that day. It was really uncomfortable for me to even have any form of light, so I wore sunglasses the whole time. In terms of when you can see again, I would say that by the evening, if you were to have your procedure in the morning, by the evening you can see fine and there's no pain and it's slightly blurry. One thing that they were absolutely adamant about is that you are not to touch your eyes for 2 weeks. The reason being is, you'll want to turn this off if you're squeamish, but the actual procedure is that if that's your eyeball, they slice part of your retina, flap it open, do the laser, and then flap it back. So whilst that flap is healing, you're not to touch your eyes for 2 weeks. They gave me these eye shields. You have to wear these to sleep in every single night for 2 weeks. And after the initial day, especially if you're wearing sunglasses, you do really get used to not touching your eyes at all. I've seen a couple of videos, again, when I was doing my research, people were like, oh, they said I couldn't wear makeup for 2 weeks, but I wore it after a week. I'm not going to pay £3,590 to wear a bit of eyeliner 1 week earlier. I fully did listen to everything they said, and I didn't touch my eyes until the 2 weeks were up. And even then, you feel like, oh my God, can I actually touch my eye? Whereas now, this many months down the line, I can rub my eye and do whatever it is that you would do to your eyes normally. So it was absolutely fine. They also, when I was sent home, gave me 1,000,001 drugs, well, 3. So the different eye drops were for different things. So at one point I was putting 4 different eye drops in my eyes 4 times a day, then it just reduces, but they give you all of the information and everything's written down, so you know what it is that you're meant to be doing. Again, that could also vary with which clinic you go to. Are you worried your eyes will get worse again? I'd like it, but I worry I'd need it again after. Even for the money that it cost, I would pay to go through that again.
in 20 years time if I needed to, rather than wear contact lenses and rely on eyewear every single day. I think as well because with my job I am using my eyes a lot, I'm having to look up close a lot. I don't think that I could ever go back to wearing contacts or glasses to the extent that I was. There was very few things I could do even just around the house in my everyday without some sort of vision on my eyes. So although it's a lot of money, and although yes, it's not guaranteed for life, as you age your eyesight naturally will deteriorate, they can say that you may perhaps need it done. One thing that I was told was that in your, I don't know how it is for men, but as a female, there's a period of time in your 20s as a woman where your eyes deteriorate the most, and then it kind of stabilizes mid to end 20s. So by the time you are approaching 30, your eyes should have kind of stayed more of a stable rather than decreasing quite rapidly, which is exactly what happened to me. I stayed around -3.5, -3.75 for a good year to year and a half. So I would say that my prescription was kind of a little bit more stable by the time it came to having my laser eye surgery done. But yeah, like I said, I would rather find that money in 20 years time and go through that again with some paracetamol rather than have to rely on glasses or lenses for another period of my life. I understand that like maybe when I'm 80 and I need some reading glasses to read up close or something like that, I'm absolutely fine with that. But to have to rely on eyewear to the extent that I did before, I don't think I would ever be able to go back to that now that I can just see. Were you concerned about the risks? If so, what? And what convinced you to go ahead? This is the consent form. It's like 1, 2, 3, 4, 5, 6 pages long. They were so strict about reading it thoroughly, and every single section had to be signed both by me and the surgeon. And it's quite a in-depth consent form, I would say. To answer it generally, it was affecting me so much, and it was something that I really believed would be life-changing, to be able to kind of like open my eyes and you know, see without having to put something in my eye or having to pick up my glasses. The only thing that I would say is that I think people underestimate like laser eye surgery, and because it is so quick and because there are so many great and quick things about it, you kind of underestimate that actually it is a huge deal. It is quite a big procedure, and things like saying you can have it in your lunch break don't give it justice for what you go through when you have it done, if that makes sense. But saying that, I've just told you that if I had to have it done again, I would definitely go through it again, knowing what the results are the other end. So I guess when you do the research, and when I spoke to the surgeon, and bearing in mind I put this off for 5 years beforehand, it was just one of those things where I was like, right, I'm finally going to do this. I'm going to ring up the appointment, I'm going to ring up the consultation, and then each time that I would get closer and closer to the surgery, I was like, okay, right, well, I'm actually here now, I'm having it done. I remember by the time the day I paid the deposit to have the surgery done, I remember my contact lenses kept folding over in my eyes and they were getting really irritating. Is it true you have to stare at the laser, and if you blink or look away you could be blinded? Again, I'm not a doctor, I'm not a surgeon, I don't know the ins and outs of it, but for my particular surgery and the type of eye surgery that I had, which was LASIK, LASIK, they told me that when I'm looking at the laser, if I was to move my eye, the laser just automatically turns off. So there's no risk of the laser slipping or anything like that. That is not a possible outcome. So that's what I was told by my surgeon and the receptionists and the nurses and stuff. That's what I was told. And that did make me feel a lot better. But it's one of those things where you think all of these things might happen. Like you think, oh, I'm going to get scared and look away, or oh, it's going to be too painful, I'm going to want to shut my eyes. It just doesn't happen. You just focus on what it is that you're there to do. And I can't explain, but the way the surgeon dealt with it was that there was nothing else for me to possibly focus on than him speaking and what he was saying to me. So if he was saying, eyes straight ahead, keep looking there, that's it, nearly done, only 5 more seconds, counting down, and it was a bit like that. So I just listened to his instruction continuously and did exactly what he said, and at no point did I want to move my eyes or feel the need to move my eyes, or it's just over so quickly you don't even know. What's your prescription and can you see perfectly now? And did it hurt? I've answered 2 of them. Can I see perfectly now? On my last appointment, they said I had 20/20 vision, and I couldn't wish for. I'm like looking around to see what I can see. I couldn't wish for better eyesight now. I'm so happy. It has changed my life, and it is definitely the best thing that I ever did. Are your eyes drier and more sensitive to light now? So when I was 22, I went on a course of Roaccutane, and it was from going on those tablets that my eyes became really sensitive to light. And I remember I used to think people were ridiculous wearing sunglasses inside, or sunglasses when unless there was a bright sun in the sky, I would think, why have they got sunglasses on? And from doing that course of tablets, I then felt the need to constantly wear sunglasses. So my eyes were already quite light sensitive. And with that being said, I would say that they are slightly more light sensitive now to before, but it's completely manageable. I have a pair of sunglasses in my car that just stay in my car, and then I have like my nice sunglasses that I wear if I'm going out somewhere. I did treat myself to a proper pair of sunglasses because I thought, what is the point in spending all of that money on having your eyes done and then not protecting them from the sun when you're out in it, especially as they are now a little bit more light sensitive. In terms of dryness, a tiny bit, but nothing that like a couple of eye drops now and again don't sort. So it's absolutely fine, completely manageable. Where did you get it done? And how did you pick the place? So I got mine done in Optimax Bristol, and I did research on all the different places, and I can't really say too many negative things about them. I thought they were fantastic. The only thing that I would say is when I came out of the surgery, I think what I would have preferred to happen is for them to kind of say, right, now go into this room, lie down with your eyes closed for a few hours, try and sleep if you can, we're here if you need us. Because during that time instead what happened was David was driving me home with my eyes closed, I couldn't open them and the pain was unbearable and I didn't know what was going on. So I think perhaps if I was to have gone to an eye hospital or perhaps a specific, maybe an actual private clinic rather than a franchise laser eye surgery clinic, perhaps you would have got that extra level of care. Mainly because it was kind of scary not knowing what was going on, and it would have been great to have someone there to just kind of keep you comforted, I guess. So I hope that kind of covers everything. If I've missed any questions, please leave me a comment down below and let me know if you have any other questions. But like I said, I only have the knowledge of my experience and what happened with me, and I'm sure it's a very specific individual situation to each person and each prescription. If you did enjoy the video, please give me a thumbs up and let me know what you thought. I'm going to leave a link down below to the place that I got mine done, and I think if you book via that link, you get £50 and I get £50, I think. Maybe I might be wrong, but yeah, I will leave the link below to where I got mine done so you can go and check it out. They were fantastic. The surgeon was absolutely incredible, and I would do it again in a heartbeat.